bioTE certified providers are hormone balance leaders who offer patients increased energy and muscle strength, greater ability to lose weight, reduced mood swings, better sleep at night, mental clarity, and increased libido. I feel like the list can continue to go on too. And here to explain further are Doctors Gary Donovitz and Dr. Tammy Horner. How are the both of you?
Doing great.
Great.
Thanks for having us.
Well, we're excited that you are here because I've definitely heard things about this, but don't know a lot. So first, break it down. What is bioTE?
So bioTE is a company that teaches doctors how to optimize men and women's hormones, because if your hormones are optimized, you feel better, you have a better quality of life, and there's so many benefits. So most physicians were never trained, and we're just training them after residency while they have a practice, and it becomes a big part of their practice.
Well, I'll say one of the physicians here, of course. Doctor, I want to first start off, how long has hormone therapy been around?
Well, actually, pellet therapy has been around since the 1930s.
Really?
Yeah, it's been used in 5 continents. It's used all over the world.
Wow. Okay, that's definitely been around, and I've kind of heard some controversy around it. So kind of set us straight, if you will.
Well, the controversy really was that testosterone and estradiol in pellet form was used in women first, back in the early 40s actually, and went around the country and then kind of got moved over to Europe and Australia. The benefits haven't been realized here until just recently, and we found out that, you know what, if your hormones are optimized, testosterone and estradiol in women and testosterone in men, you could lower your risk for Alzheimer's, breast cancer, prostate cancer, heart disease, the #1 killer for men and women, lower your risk for diabetes, improve your sex drive, and improve your sexual performance. If you could do all of that with something so small as a pellet, wouldn't that be great? And now people are saying, wow, can you do that with small side effects? Yes, you can.
Okay, we've heard the word now, pellet. You say it's a small pellet, Doc. Let's see it. What are we talking about here?
Talking about something the size of a grain of rice. It's so small, we just put it right back here in the hip. It doesn't hurt at all going in. The good thing is it lasts for 3 to 4 months in women, 4 to 5 months in men. So you do it 2 or 3 times a year and you're done and your hormones are optimized.
What are the benefits that you're hearing in your practice? What's the feedback you're getting from some of your patients?
Well, Natalie, I've been using pellet therapy to optimize hormones for several years now, and probably the best benefit that we see in our patients is weight loss. A lot of our patients come to us, they're on medications for depression, anxiety, sleep disorders, and a lot of these medications cause weight gain. So once we were able to optimize their hormones, not only do they take the weight off, but they're able to come off of those medications. They feel great. They have more energy, more mental focus, mental clarity, and they sleep better without the medication.
You know, I'm curious, as I was reading that list to introduce you guys and just listening to the both of you talk, I mean, the list is things like, yeah, I probably have mood swings, or my husband would say so, or I'm tired. I mean, people probably can relate to a lot of these symptoms. When is it time to pick up the phone, though, and actually give you a call to get more information about bioTE?
So for women, they start losing testosterone in their mid-20s, men in their 30s. So it's never really too early to get your hormones checked. Getting your hormones checked is the first step, and then we figure out how do we optimize your hormones, including your thyroid. We do all that at bioTE. That's the way you get your life back. So no matter what your age, you feel your best. That's kind of our goal.
And when you do get the pellet, and you say it lasts 3 to 4 months, though, how long does it take to start seeing some of these benefits that you both have talked about?
So usually for the testosterone, it kicks in about a week. The estrogen kicks in about 3 days. So within the first week, you actually start feeling better.
And have you noticed that in your practice as well?
Yes, definitely. They feel better within a few weeks, and they come back and tell me, you know, Doc, this therapy has changed my life. Sometimes I hear this has saved my marriage. I hear just wonderful things from the patients, and that makes me feel great.
It's like couples therapy.
Yeah, exactly.
And I know you've traveled around the country talking about this, so I'm sure you've seen plenty of people talking about how their lives have changed.
Right. You know, pellets are not fascinating. Changing people's lives is fascinating. And we've changed so many lives around the country, both men and women, who really thought they were going to have to stay on medication for depression and all these other things the rest of their life. They're like, wow, I had no idea I could get my life back.
I'll say, and I'm glad you brought up medicine, the side effects. Are there any negative side effects that people need to be aware of, like medicine sometimes do cause?
Right. You know, the side effects for hormone pellet therapy is really very small. For women, you may have a little acne in the first round. You may have a little bit of facial hair, not much, in the first round. That's really about 2% of the people. So really very low side effects. Overall, we see less than 1% side effects, and we've done more than 600,000 insertions.
So if someone's watching this at home and they're interested and they're like, yes, today's the day I want to make a change, what's the best way to learn more about this or get a hold of you?
Well, for us, you go to bioTEmedical.com and you can find Dr. Horner right here. And I think there's a number right up there. What's your number?
It's 727-548-0001.
Of course, that's the number there on your screen, along with their website, bioTEmedical.com. Guys, you did a great job explaining this. Thank you so much for coming on today. We appreciate it.
Thank you so much for having us.